Trained, board-certified anesthesiologist and integrative medicine specialist. And today, I need to start off with a story about a patient who I called the other night. First thing they said to me before their surgery was, "Doctor, I need a lot more pain medication than anyone else." I'm like, all right, don't stress. Don't be concerned about not getting enough anesthesia and being awake. Hey, Pika Kirby, good to see you on, by the way. I then asked the patient, why do you feel that you need more anesthesia? What surgeries in the past have you had before where you needed more anesthesia? And this is all going to come down ultimately to this medication that I'm holding here and this medication here. In case you can't read the labels, ketamine, propofol, and there's a couple other medications like the gases that come out of the ventilator. Well, how did this conversation go with this patient and how did it boil down to anxiety? It's just a matter of, why do we feel that we have certain requirements that maybe other people don't? Do we feel that we're special? Are we like different than other people? I'm not saying, I'm not gaslighting this patient, but I'm sharing a reality. When patients of mine before surgery, remember, this is an operating room. I know there's a window behind me, but this is an operating room. Here's a patient bed. A patient is going to be on there in a couple hours having surgery with me, connected to the ventilator and all. But when rigid cognitive loops form in our minds where we begin to think things that aren't true, and those thought patterns might become reinforced and enabled over time by what other people tell us, by what we continuously think, and that can lead to anxiety, that can lead to higher anesthesia requirements, because it's a very physical change in your brain that happens when we go through the same cognitive loops over and over again. It's not just what you're thinking, it's actually what your brain and body are doing, because we see it when you're under anesthesia. And that's where these medications come in, and what happens to your anxiety when these medications are fundamentally changing what we call your self-representation. That's another way of saying, change the way that you view yourself. And those cognitive loops that you may have spent years forming, make it really, really hard, that might ultimately be causing your pain, anxiety, depression, or other physical or mental conditions. And of course, they're all related because the mind and body are so heavily related. So it's good to see people coming on. This is a reminder, if you appreciate me coming on here, even at the end of a long day in surgery, do please hit that like button and share with others. I'm just going to review these questions, make sure there's nothing that people want answered before I go back into the anxiety and specifically ketamine, like what I offer my patients in my clinic outside the operating room. Deanna is asking about her surgery next month and what can I ask to calm my nerves? Okay, Deanna, great question. There's many things that you can do to calm your nerves, and of course we'll do things as well. I don't have any of the midazolam nearby, but the most common go-to is midazolam that anesthesiologists give. It's like Xanax or Valium or Ativan. However, that being said, there's many things that I encourage my patients to do after I've spoken with them, not just, randos, but my patients, often around lavender, because aromatherapy with lavender does not have any documented interactions with anesthesia when done under medical supervision, as does German chamomile. Those are both safe supplements that I recommend my patients to continue during surgery, assuming they don't have any contraindications. It's not the same for many other supplements, but German chamomile and lavender in the form of aromatherapy can be powerful when combined with the mind-body techniques like the thoughtful breathing that you've seen when I connect myself to the monitors. All those things prime your brain to not fall into an anxiety loop when done with the right guidance. Great question. Check out the rest of my videos for all sorts of other techniques on how to calm your nerves before surgery, because so many patients have that same question. Now, I want to go back to ketamine, because this is, oh, no, I can't. Heidi is saying, Lucy here has asked a question. I have bad anxiety, especially now I lost my brother 3 weeks ago. I had to have surgery one time. It took them half to calm my heart. Well, Lucy, I'm sorry that you had that experience. I'm very sorry for your brother's loss. And I think everyone else here in the audience is also expressing their condolences. Hopefully what you learned today can also help give you the tools to get your anxiety and nerves under control, because what you experienced from your brother's complications certainly can contribute to medical PTSD, what we've talked about before. And the same concepts about what I'm going to talk about with ketamine, like I have here, similar to other psychedelics and other anesthetics like the propofol that I have here, can actually help with a lot of the neuroplasticity that can help retrain our brain into reinterpreting that experience, to not let it be as much of a PTSD, have that kind of burden on us. But first and foremost, I'm really sorry for that. I do wish you the best. If you have any specific questions, I'd be happy to answer them. Now, earlier I said, and this is what patients come to me all the time before surgery with a rigid thought about surgery. Some of them have never had anesthesia or surgery before. Some of them have had many before. But I always share the example of the willow reed and the oak tree. The willow reed, I'm sure maybe you've heard this before, the willow reed can take all sorts of battering left and right. But the mighty oak tree will snap in that storm because of the brittle nature. It's strong, but once it snaps, it snaps. It doesn't have the flexibility to go back and forth. And cognitive flexibility and cognitive rigidity are very similar in our minds and bodies, like when patients are in the operating room here with me. Patients who come in with the strongest, most ironclad thoughts about themselves and how the surgery is going to go, how the anesthesia is going to go, they're the ones that typically have self-prophesizing actually bear out. So when they tell me, Doc, I'm going to wake up in a lot of pain, they wake up in a lot of pain. When they tell me I'm going to wake up with so much nausea, it's harder for me to give medications that can help calm that nausea down, to prevent them from vomiting after, and so on and so forth for so many other complications. So when somebody's having a psychedelic experience, like with ketamine, there's this whole neuroplasticity that comes up. You may have heard of it before. And just to be very clear, neuroplasticity happens all the time in our brains when we're learning anything new. However, the degree of neuroplasticity, when given an intravenous dose of an anesthetic, whether it be the white stuff, but more commonly ketamine, allows for a profound neuroplasticity that lets us literally rewire parts of our brains over time in ways that are not as cognitively rigid. It lets us reevaluate what are these habit loops that we're going in. It might sound elementary. It might sound like, well, so cliche, the doctor's telling me what I already know. That's not been my experience, though, in stressful scenarios like here in the operating room. When patients are coming in the most scared moments of their lives, they're about to have their memories wiped, depending on the type of anesthesia they're going to get. And our habit loops come into full force. When we get stressed, we don't rise to our best. We sink to our worst. It's what one of my attending physicians told me when I was a medical student at Stanford a long time ago. That's why residents, like when I was a resident back at Harvard so many years ago, we practice the same thing over and over and over again. So when emergencies happen here in the operating room, we might still sink to our worst, but our worst is so advanced and so well practiced that we can save the patient's life. So when they're here and we're doing CPR on this table and I'm drawing up the epinephrine, I had to do this last week actually for a patient. I don't have to, my fingers aren't trembling anymore to drop the most potent medications known, because my habit loop is in a place where patients are going to be safe, they're going to survive, and I'm not going to fall to a level where I can't perform. The same goes for any type of anxiety, for any type of depressive thought patterns. The same goes for PTSD to an extent, and chronic pain. Migraines, so many other pain syndromes involve, not exclusively, but typically in part and maybe in large part, falling back into a habit loop, which is what our brains do very well when we're stressed, anxious, when we're entering the fright or flight response. Let me take a quick pause because there have been so many comments coming and I want to make sure that I can answer the ones that are we can address right now. Let's see. I'm so happy that everyone gave Lucy their thoughts. That's certainly tough to have lost a brother, and the trauma that can come from that can turn into PTSD. Teresa Hill says, I had surgery on a broken wrist, 2 broken bones. They gave me an epidural near my shoulder and underarm. He said it might have to give double. I don't remember anything after that. Well, neither do I. Sorry. Fire Med Chick, good to see you. She's been getting, or he, I don't know which one, has been getting ketamine infusions for PTSD. It's amazing how well it has worked. Well, that's what we're talking about, because ketamine helps us rewrite pathological, or I don't want to, I'm not like blaming anyone, but yeah, these are pathological habit loops that are very difficult to retrain our brain from without something to jumpstart the experience. And so, like Fire Med Chick, I'm assuming as an EMT, you've had many traumatic experiences with overt hemorrhage, bleeding out, CPR, intubating, all these things. These experiences have consolidated in a way that leads to PTSD, like we talked about before. It's a habit loop. Every time that memory is retrieved, with it comes vivid smells, things that we hear, the sweat on the back of our necks, all of these, it's like all your sensory organs go on high alert from that thought being brought up in your memory, right? It's like a consolidated memory. The memory has not gone to the right place. It's not like, oh, what did I think about? What did I eat for lunch yesterday? Where it's just like, you don't start sweating. Your heart rate doesn't go through the roof. Your blood pressure doesn't rise when you're thinking about those. But for traumatic experiences, it's a loop. Your brain accesses that memory, and with it, all of that sensory hyperarousal. And it's so fascinating, so empowering to hear how ketamine has helped you. Heidi, is ketamine used for depression, or is it only used for anxiety and or depression? Heidi, thank you for asking. Ketamine is used for treatment refractory depression, because depression is also a classic example of loops of cognitive rigidity. I'm not blaming the patients, and Heidi, you know this, but just so others don't get that impression, for many reasons from childhood, from adverse childhood experiences throughout life, most Americans have had an adverse childhood experience or another traumatic experience in their life. Loss of a loved one, a painful bodily injury, etc. And when we begin to perseverate on those, or if they lead to thought patterns that involve perseveration and rumination, these are thought loops that come up in our brains, and it's very hard to exit them. If it's of the past, we call it depression. If it's rumination of future events, then we call it anxiety. The event hasn't happened yet, but we're already ruminating and perseverating over it. Those thought patterns are exactly what psychedelics, white stuff here, ketamine here, or spiritual experiences can help us rewrite. We can rewrite our own habit loops by creating new habit loops in their place. So last week when I gave the example of snowfall covering the tracks of, let's say, imagine a cross-country skiing terrain. You have these deep grooves in the snow. Those are your habit loops. Your brain falls into those in stressful scenarios. For you, for me, for everyone else. Because our brains sync to our worst, to whatever we're habitually accustomed to doing when we're stressed. Fight or flight. If I'm fleeing from a lion, I don't have time to think of a new plan. If my patient connected to the ventilator begins to cough or vomit, or they have a malignant hyperthermic reaction, I don't have an hour to sit down and pull out Wikipedia and start thinking. I need to act within seconds, just like the lion. For that reason, we sync to our habit loops, what we're used to doing, what we've been trained, what our brains have been conditioned to doing for years, often since childhood. Many of my patients, before surgery, this is the kicker, right? They've trained themselves to be like, oh my gosh, I see a needle, like this little guy here. Even when the needle is not going inside of them, I say, whoa, don't worry, this needle is not going in you. I'm just using it to drop the medication, just to be clear. This is for puncturing a little rubber cap here, like this. Oh, it's kind of hard, right? That's what this needle is for. The needle doesn't go in a patient. But they've already trained themselves to see the needle and react with a vasovagal reaction, like passing out. Their heart rate goes up, they begin to sweat. I'm not blaming the patients, but our brains begin to go into these loops. And it's like a book. You can predict exactly what's going to happen when we go into that stressful state. So I'm going to take this needle out of here. And by the way, just to be clear, this is an empty vial. It was used in surgery. There's no more medication in it, but I use it with patients who are having sedation or even general anesthesia. Now, let's get these notifications out of the way. Okay. And when we recognize these loops, we can begin to overcome them with or without medications, right? But ketamine is a powerful and safe way, when done under medical supervision, to let a new snowfall cover those grooves in the snow from those skiing tracks or whatever. And then we have the opportunity, through that neuroplastic process, that synaptogenesis, same concept, to rewrite new habit loops. So for example, instead of me freaking out in the operating room, hey Chris, good to see you. So instead of me freaking out in the operating room if the patient begins to code and they need CPR, my habit loop is not just to freak out and stare in the headlights like a deer, but it's to now begin to lead the team to run the code. When I was a resident, I remember very well, one of my codes, I kind of froze a little bit. I didn't have the habit loop enforced after, with years and years and years of training to know how to respond in the moment. I kind of froze a little bit, right? And I was able to retrain myself out of it. Not with ketamine, but with enough grueling years of residency. It's what doctors go through. So let's get back to some questions. I hope this is, I'm seeing so many questions come in here, and this is fantastic. Teresa says, me screaming when he was injecting me. After surgery, I was in so much pain. I was crying hysterically in pain for it was so bad for 3 days. Why? Teresa, I'm really sorry you experienced that. Unfortunately, without more information, I can't answer that question. But you can let me know below here in the comments if you have a more specific question for me. Lucy asks, why does anxiety give you physical symptoms where they feel real, like a heart attack? Okay, so Lucy, you nailed it here. Anxiety impacts our body very really, like what I see with my patients in the operating room connected to the monitors, even with or without the medications that I give them, because anxiety is in your brain. And it appears that almost anywhere in your body where you have nerves, well, they're connected to your brain, typically in some way through your spinal cord, and we can control nerves in our body. It stands. Clinical hypnotists believe that anywhere in your body where you have nerves, anywhere from your toes to your kidneys, to your heart, to your lungs, you may have an element of control over those nerves in your body from the nerves in your brain. This is where the classical signs of anxiety come from, because you now have a thought in your brain, a loop that your brain is going into, a fright or flight response. It very really impacts your lungs. We see it under anesthesia all the time. Bronchoconstriction or bronchodilation, salivation like sweating or drooling, heart rate going up, blood pressure changing. These are all effects that your brain is mediating. The best example of all, and Heidi here will commiserate with me on this, is that when we feel faint from seeing maybe a needle, seeing blood or whatever, that is your brain seeing an image through your eyes and then slowing off the circulation through the carotids in your neck to your brain to the point where you pass out. That's how powerful the mind-body connection is. So if that's what happens for things like anxiety, for depression, PTSD, all these mental conditions that are fundamentally affecting our whole body, like I said, I see it. I had to treat it in the operating room. This isn't like make-believe. These are life and death things that we'll see in the operating room. We need to treat them with our medications. Heck, our medications can cause the same symptoms as well, the same signs in the monitors. But if you have maladaptive, or if you will, negative thought processes cause those changes to your body, what if you have positive thought processes? And this is where clinical hypnotism comes in place. Guided imagery can come in place. CBT to an extent. When my patient is on the table here with me, what do you think I'm telling them? So this is here's where the feet go. These are the massagers, by the way, to help prevent blood clots. That's the head over there, or the head of the bed. When they're on the table there, do you think I'm telling them, oh, you're gonna be cut, it's gonna hurt, you're gonna lose a lot of blood, you're gonna wake up really nauseous from all the Dilaudid I'm giving you, from all the pain medication I'm giving? This is Dilaudid, right, a synthetic opioid. I'm not priming their nervous system for a defeat. No, we're talking about how they're loved, how they're the most important person in the world for the whole team for the next hour. Loved, cared for, guided. All right, these are the things that can begin to take an anxious loop, take it out of that fright or flight or fright response, or fight or flight response. Let's take them out of there so they're more comfortable, so they don't lean in to these habit loops that are very detrimental. The anxiety habit loops, the depression habit loops that can kick in after surgery is over. When you have the pain kicking in from the surgery, not being able to go to work, not being able to do the things that you normally do, this makes you even more susceptible to these habit loops becoming not only more experienced, but becoming deeper grooves in your psyche. So if I can help elevate patients out of the fight or flight response in this stressful moment in the operating room, that sets them up for, study after study has shown this, sets them up for a smoother recovery after. Lower chance of blood clots, infections, acute pain from transitioning to chronic pain. Yeah? That is how the anxiety symptoms come through, to answer your question, Lucy. Great. Hazel Ann, if you're still on, Hazel, I'll answer your question. A glomus tumor of your big toe, actually, removed using local block anesthetic. I'm going to ask for sedation as well, but have to be careful as I have sleep apnea. Hazel, well, you know what? I'll answer it right now because that's a super common question. If you're getting sedation, it can either be with opioids, typically not something like Dilaudid, but something like fentanyl, very low doses. It can be with ketamine, it can be with propofol. You can't do it with gases like out of the anesthesia machine because when you're under sedation, there's no breathing tube in your mouth. I can show you a breathing tube if you want, but they're in my backpack. I don't want to grab it. You've seen them before. When you're under sedation, I can't give you laughing gas in a safe way. I can't give you anesthesia gas. So it's one of these IV anesthetics. And you're right, with sleep apnea, you are more susceptible to not breathing and more susceptible to being overdosed. So obviously it's a careful balance, but we manage that for you as your anesthesiologist. It's our job. Hey from New York, says Tanya. Hey back from California. And hey, just as a reminder, guys, if you're appreciating what I talk about, do please hit that like button. It does help support me do this more often. And more importantly, I work on these with my patients outside the operating room in my ketamine infusion clinic in San Francisco. And it is not me solving anyone's health empowerment issue. It's patients. My patients simply learn how they can rewrite their own habit loops. That's what ketamine and what low-dose anesthetics can do. So as much as people comment on what I do for them, it's very nice, but just to be clear, this is us discovering our inner healing potential. So whether you're in the operating room with me, in my clinic with me, it doesn't matter. It's you figuring out for yourself how you can tap into your innate healing potential that all humans are born with, in large part due to that mind-body connection that we talked about. Alex says, new doctor proposed possible complex regional pain syndrome. Can you talk about treating this? CRPS, Alex, is a very challenging condition because we don't understand much about it. Just so everyone knows, CRPS is, we believe, or there's type 1 and type 2, but we believe it's a result of wiring of nerves that has gone haywire, no pun intended, between the brain and the body part that's been injured. After an injury, nerves get damaged. When nerves regenerate, we believe that some nerves don't wire correctly, and they actually wire in perverse ways that cause our brain to sense pain, even if there's no painful stimulus there. Have you heard of phantom limb pain? Where somebody has an amputation and they can feel pain in the amputated limb, but it's like, hey, there's no limb there. How are you feeling that pain? We believe it's in part due to nerve endings that have been cut, and as they try to regrow, they regrow in ways that are completely tangled and scrambled, that mess up the brain's perception of pain. So CRPS, we believe, is similar. We don't know for sure. That being said, believe it or not, ketamine is being studied and has shown benefit for patients suffering from CRPS. This is by no means saying that ketamine is a snake oil. That's not what anyone should ever push. But since we know that pain is 100% in the brain, 100%, we can talk about this in a different live stream. Because this is what patients, they think that pain is like something their body is experiencing. Yeah, but it's all in the pain, all in the brain. 100% of pain is in the brain. You cannot have pain without your brain feeling it.
Just make sure your lights are off.
Thank you. You can't have pain without the brain there. And psychedelics like ketamine help rewire our brain, possibly, we believe, to adjust our brain receiving scrambled signals from a CRPS type pathology so that they're not interpreted as pain, or pain coming maybe from a phantom limb pain. Clearly there's no noxious stimuli there because it's I gotta get rid of these notifications on Discord coming in. If there's no limb, how can you be getting that pain? You can have pain there, but it's because the brain is receiving signals. So how can we rewire the brain to not receive those signals and interpret them as pain, but instead interpret them as like a touch or a poke, not as pain? All right. I hope that answers your question. We're running low on time here, so I wanted to just take one last opportunity to answer. Oh, so many great questions. We'll have to save them for next time. Mikey asks, what would happen if the op would have gone ahead with my swelling heart palpitations? Oh, we'll end with this question. What would have happened if you went to sleep with heart palpitations under general anesthesia? You're gonna have a FES, so it's a nose surgery, under local anesthetic, as is just for one nostril. Mike from the UK. Well, hey, Mike, thanks for sharing your story. And just so, patients ask me this all the time, so I'm happy that you asked. Palpitations can be from anything. Typically, palpitations are like an extra beat that somebody feels. If they're really bad, patients might pass out. Palpitations can be from atrial fibrillation, atrial flutter, premature ventricular contractions, also called PVCs, premature atrial contractions, the list goes on. Doesn't matter the specifics, but what does matter is that surgery can cause a massive influx of what's called sympathetic surge to the whole body. It's because pain, in and of itself, increases the stress of our body, meaning that it increases cortisol, it increases epinephrine and norepinephrine levels, so it puts your body in hyperdrive. Pain itself puts your body and brain in overdrive as well, by the way. But when you're having surgery, one of our concerns is that if your heart is already beating funny at baseline, if you infuse it with a load of sympathetic stimulation, that's a load of fight or flight response hormones, what's gonna happen to your heart under that much strain? It might have more of those palpitations to the point where it might not beat anymore. It might go into what's called a malignant arrhythmia, and it might not, we may start doing CPR, it could be lethal. In the vast majority of cases, it's not. The vast majority of cases, it's not an issue, but that's why we order an EKG, maybe do a stress echocardiogram, a stress electrocardiogram, a stress test, etc., depending on the patient. That is why we care so much, because surgery is a huge stressor to the body. You know what else is a big stressor to the body? Anxiety. Getting up and giving a speech can be used to predict future heart attacks because it's such a stressor on the body. The difference, by the way, between a mental stress and a physical stress is that a mental stress, your body is killing itself in that it's vasoconstricting, increasing your blood pressure that way. When you're exercising, your blood vessels are actually relaxed because they were trying to increase blood flow to your muscles that are working hard while you're exercising. And your blood pressure goes up because your heart is beating stronger, not because your blood vessels are constricting to raise your blood pressure. Fascinating stuff that we can continue the conversation with. I just want to end by reminding everyone that you have more power over your health than you've probably ever been told. And the whole point of me coming on here and talking about these medications is not because I'm trying to sell them to you, but so that you know that you have a potential, either through a spiritual awakening, through a psychedelic experience, through an anesthesia experience in surgery, even in the darkest moments of our lives, like my patients often have here in the operating room. No matter what the situation is, cancer, a traumatic bone fracture, heart surgery, whatever, you can find incredible empowerment, even in those dark moments of pain, of fear and uncertainty, with the right guidance, whether it be through medication, through your spiritual guidance, through a doctor. And that's all I'm here to do. I can't fix anything. I can just help your body heal itself. It's really what any doctor can do. So I hope you all learned something. I look forward to seeing you on the next live stream. And as always, you have more power over your health than you've probably ever been told.